Hi, my name is Arran Davis and I'm an evolutionary anthropologist. I'm interested in how our social connections affect our health. So this study used survey data from the European Social Survey, so it's over 20,000 responses across 20 different countries, and we were interested in how income relates to loneliness and to a defensive symptom cluster characterized by elevated levels of pain, fatigue, and low mood. So the symptom cluster, these symptoms often co-occur and mutually reinforce one another. And the way that we try to understand the symptom cluster is through an evolutionary perspective. So we see humans as having evolved in small, tightly knit groups through which our sort of safety and access to resources were tightly channeled via our social relationships. So when we feel socially excluded or isolated, our bodies respond with a sort of defensive set of symptoms that are meant to protect our body. So things like pain help protect our body, and things like fatigue help conserve our bodily resources. So this is sort of our body's way of responding to the signal that is danger and resource scarcity that is associated with being socially excluded. However, when the symptom cluster becomes chronic, it can have negative long-term health consequences. So you might have heard that social connection is one of the strongest known predictors of health outcomes. It's on par with things like exercise and smoking cigarettes. And so the presence of this symptom cluster, especially when it's chronic, could help to explain these connections. I'm interested in this subject for a couple reasons. So personally, I grew up in a working class town in the Midwest in the United States. I've seen how social relationships and money and health can interact in complicated ways and influence one another. But also as an academic, I'm interested in how social and economic changes to working class life affect our health outcomes. So thinking about things like changes in the economy, such as more gig jobs, outsourcing of work, and sort of a loss of local business, and how these can affect the sort of social fabric of working class communities. This study used survey data from the European Social Survey to investigate our hypotheses about the relationships amongst poverty, social connection, and health. The findings of this research can be summarized, I think, in two plots. So the first plot is looking at how loneliness varies across income deciles. So we found some really striking gradients in loneliness across income deciles. So people in the lowest income decile, nearly half of them said they felt lonely in the last week, 49%, versus just 15% in the highest income decile. And what is particularly striking about this is that the survey also asked people how often they got to socialize with their friends, family, and colleagues. And what we found was that across income deciles, everyone reported socializing basically the same amount. So it seems like there's something else about social relationships under the strain of poverty that are different, and perhaps giving this people a feeling of lack or loneliness in their daily lives. The second plot shows how both loneliness and income relate to the symptom cluster that I mentioned before. So the first thing that you can see is that the orange dots, those represent respondents to the survey who said that they felt lonely in the last week. And so what you see is that not only are they more likely to be in lower income deciles, but they're also much more likely to have high scores on the symptom cluster. So if you look at the first income decile, you see much bigger differences between lonely people and not lonely people as compared to the top income decile, where being lonely doesn't have such a strong effect on the symptom cluster. And so these findings kind of suggest that social relationships might be particularly important for people already struggling with the difficulties of poverty. And these relationships hold even when we control for things like marital status and living arrangements. So it really seems that it's people's perceptions of loneliness that matter when thinking about health outcomes. These findings illustrate that socioeconomic circumstances not only affect how much money we have, but also how we relate to other people and our sense of belonging in a broader community, and that these feelings can affect how our bodies work on a daily basis, and that this can have really important implications for our health. I hope that this study first inspires more research into the factors that lead people to feel socially disconnected in the first place, especially people living in poverty. And I'm also interested in learning more about the mechanisms, so the physiological mechanisms through which socioeconomic status has its well-observed impacts on health. On the policy side, I think this research highlights the health costs of fragmented social fabrics and also highlights the need for policies that help people find belonging and support from their communities.